Thank you for inviting me here today. My name is Irene O'Donnell. I'm the Regional Director of the SHINE program. The main office is out of Mystic Valley Elder Services in Malden. You have a SHINE counselor here, Jeff Bemis. Jeff is here on a scheduled basis to help you with your Medicare issues. The SHINE program has been around for quite a few years. In Massachusetts, it's called SHINE. It's called SHINE in Florida and one other state. I think it's North Dakota. Everywhere else is called SHIP. So it's the SHIP program is really the national name of the program, and it's really under the auspices of Medicare, obviously. So I've given you a copy of the presentation. You can follow along with it. The Medicare open enrollment period, again this year, is October 15th till December 7th. So Pearl Harbor Day is how I remember that date. So keep that in mind. And what is open enrollment going to be doing? And we're going to talk about that throughout this presentation. But this is the time of the year that if you're currently in a plan, you can change that plan. Perhaps the drug coverage isn't what you need. Maybe the HMO that you're in, if you're in an HMO, doesn't have all the doctors that you go to in it, they're not in the network, things like that. So this is the time of the year to do that. If you're new to Medicare, you're not restricted to open enrollment. You're in what's called the initial enrollment period. You've got some other dates, although you can do things during open enrollment if it happens to coincide with your initial enrollment dates. Okay. So SHINE. SHINE stands for Serving the Health Information Needs of Elders. However, I have to qualify that a little bit. The SHINE program provides counseling services to all Medicare beneficiaries. Doesn't matter how old a Medicare beneficiary is. And what you may or may not know, but if somebody's on Social Security disability for 24 months, in month 25, they automatically qualify for Medicare. So you could be 25 years old and be in that situation, and you're a Medicare beneficiary, a SHINE counselor will clearly help you. We don't charge for our services at all. We will provide you with free, unbiased information about your health insurance plans. As you know, Medicare, or you may not know, but you'll find out today, or if you've been using it, it doesn't pay for everything. It never was designed to pay for everything. So there are other ways to supplement your Medicare coverage, and those are typically through private insurance companies. So we are unbiased. We give you unbiased information. There's no way you can get a SHINE counselor to pick something for you, I can tell you that. If you do, let me know. That's not supposed to happen, okay? But to guide you through that process, and it is a challenging process. We have 600 SHINE counselors in Massachusetts. About 85% of those SHINE counselors are volunteers. The rest of those SHINE counselors are people who may be doing this as part of their jobs. They could be social workers at a senior center, outreach worker at a senior center, resident service coordinator at a senior building, and they do SHINE as part of their counseling, to be as part of their job. To become a SHINE counselor, one has to go through 60 hours of training, take a certification test, go to monthly meetings, and be recertified every year via a test. So there's a lot to learn just from the start and ongoing education all the time. As you can imagine, there's a lot of information coming in right now with changes that are happening in healthcare. So SHINE counselors are very dedicated people. It's based on a volunteer model, and we really depend quite highly on the SHINE counselors. Most SHINE counselors are at senior centers. Occasionally, again, somebody may be at a building. We are actually, and I ask this at every presentation, perhaps you know of a location that may make additional sense for us to be there. A library, maybe a condominium that we could go to once or twice a month, by appointment, if there are people there who, not everybody is at the senior center. A lot of baby boomers are still working, but still going on Medicare, at least Medicare A, and want to know about it. And we're here at the senior centers, which is wonderful, but just so that you know, 10,000 baby boomers a day are entering Medicare. That statistic has been there for, yeah, well, a year from now, I'll be signing my papers too. So that's been a stat for almost 2 years now. That's a lot of people a day. That's a national number. Thank goodness it's not a Massachusetts number. I would need a lot more than I have 50 volunteers, 50 Shine counselors. I have 21 cities and towns. It wouldn't be enough if that was our number here. But certainly, I mean, if you know of anybody, you know, another location that, you know, occasionally might make sense for us to go to for counseling, or even to do a presentation, you could let Jeff know and he'd find me, and we'd be glad to do that. Maybe there's a club or an organization, a church group, someplace else that you know that where people who are interested in hearing about Medicare may want to come and find out about us. So keep that in mind. So there's some important dates for us to remember. October 15th, which I mentioned at the beginning, that's the beginning of open enrollment. And it's a Monday this year, so that helps, that's good. December 7th is when it ends. And your coverage would begin January 1 for the choices and decisions that you make during open enrollment. So if you look, I wish there was a color chart, but it isn't, but there's this little fancy chart here. Okay. It looks so much better in color. But there are two ways to take Medicare. Just think of it as two routes. It's all the same overall program. But if you look on the left-hand side of the ledger, where it says Original Medicare, I'm on page 3. See, the chart's right there. You've got that chart. Okay. Yeah, that chart. Yours is much bigger than my chart. Okay. There's Original Medicare, and then there are Medicare Advantage plans. So let's talk about Original Medicare first. That's the Medicare that's been working the same way since 1965 when Medicare first started. Okay. You have Medicare A and Medicare B. Medicare A, you have money taken out of your paycheck every pay period, and that's how you were paying for Medicare Part A. And if you didn't pay into Medicare all those years, or you only paid a little bit, you didn't pay the 40 quarters that it would take to not be paying a premium for Part A, and you had to pay for that full premium right now, it would be $450 a month. So that little bit that was coming out of your paycheck for all those years, as much as we don't like to see our net pay lowered, you really were investing in yourself with that money. So keep that in mind. The other thing is Medicare Part B. So Medicare Part A covers the hospitalization end of things. Medicare Part B is what covers you for doctor's visits, any outpatient services. When you sign up for Medicare B is when Social Security starts taking that money out of your paycheck, out of your Social Security check. Right now, the Part B, B as in boy, premium is $99.90. It can go up. We don't know that yet, okay? Some years it goes up, some years it stays the same. We almost don't know it until November, typically, and I'm sure we're not going to know it until after the election this year, so don't expect it early in November. But no matter what, it's always been around the November time frame, election year or not, it's always been around that time. So unfortunately, we never know that number until we're well into open enrollment. But keep in mind that that $99.90 premium might change a little bit. But if it goes up, it's not going to double. It might be $10 a month, something like that. But it never takes a huge leap. Okay? So Medicare Part A and B, we're still looking on the original Medicare side of things. Again, only covers about 80%. Whether it's for A and B, so there are gaps in your coverage. So very often you'll hear about Medigap insurance or supplement insurance. That's to pick up those 20% differences in what Medicare A and B doesn't cover. You do not have to take a Medigap or Medicare supplement plan. Most people do, otherwise you're responsible for that 20% of what isn't covered. And there's a chart that you'll find over there, a piece of paper that says Medicare A and B on the other side of the benefits and gaps. It's a great piece of information. It'll just give you a pretty good idea of what those gaps really are. And it's on the counter over there, so I would recommend that you take a look at that. But if you wanted a Medigap plan, or supplement plan, there's a blue chart over there, and this is what the list looks like of supplement plans. In Massachusetts, we're very lucky. Our supplement plans are mandated to provide the same coverage. There's 2 levels of supplement plans under Original Medicare. There's Supplement 1 and the Core Plan. And this chart is there, and on the back it will show you the differences with those. The major difference between Core, and the premium is almost half of what the Supplement 1 premium would be. But the major difference is if you go into the hospital, you have a deductible of $1,156. There's 2 blue sheets over there. $1,156. Every time you go into the hospital, as long as there's 60 days in between your last discharge and your next hospitalization. So per benefit period, which has a 60-day window. So you could be paying that $1,156 if you were unfortunately in and out of the hospital a couple of times during the year, a few times, if you didn't have any supplement insurance. That's the major difference between Core and Supplement 1. However, see how you've got 7 companies here. 7 companies cover Core, 7 companies cover Supplement 1. They are all mandated by law in Massachusetts to provide you with the same coverage. Just because you're paying more for a premium under Supplement 1 or a higher premium under Core, within those categories, you're getting the same Core coverage all the way down and the same Supplement 1 coverage all the way down. Any questions on that? In other states, that's not necessarily true. If you lived in Florida, it's a huge choice of decisions, and there's all kinds of deductibles, there's different pre-existing conditions. None of that happens here in Massachusetts. It's a guaranteed issue. There's no problem at all with a pre-existing condition. If you're on Medicare and you have Original Medicare A and B, your supplement plan will work with Medicare, with anybody who takes Medicare. So this is one way, again, we're still working on the Original Medicare side. The other thing to complete the picture is prescription drug coverage. Prior to 2006, there was no drug coverage with Medicare. Okay, so it started in 1965. Really not much changed until 2006 when drug coverage came in. So Original Medicare A, B, supplement plan if you want it, and a drug plan. And we're going to talk more about the drug plans further into the presentation. On the other side of this chart, you'll see Medicare Advantage plans, okay, on the right-hand side. Medicare Advantage plans started about 15, 20 years ago. They're the HMOs of Medicare. So just the way every HMO has ever worked, if you've been on an HMO plan through your employer, you have a network. So you still have to have Medicare A and B. You're still paying the Medicare B premium. But Medicare is really in the background. It's the private insurance company that's really covering you. It's Blue Cross or Tufts or United Healthcare. They have a contract with the government to provide you with your Medicare coverage, and the government is moving that money behind them, and then you're paying premiums for it as well as you would with any of them. It's really the one-stop shopping of Medicare. If you don't go to a doctor very often, and all your doctors are in the network of the plan that you'd like, you could have all your Medicare and your drug coverage all under the same company. There's co-pays every time you go to a doctor's office, as there would be any time you go with an HMO plan. With the supplement plans, however, you're paying a higher premium, but you're not paying co-pays every time you go to the doctor's office. So your own circumstances will help make that decision for you in terms of which way you go. When you're making a choice about whether or not to go to Original Medicare or to a Medicare Advantage plan, you're not making a lifetime decision, you're making a one-year decision. There's open enrollment every year. So you might want to try something for 1 year, see how it works for you. If that's what makes sense for you, it's the right route to go. So again, there are 2 different routes to go with that. Some people have VA coverage, which they may use just for their drug plan. So they could get their drug plan that way. You have to have creditable coverage in order to not pay a penalty if you don't pay a Part D plan, the drug plan, D for drugs. VA coverage is considered creditable coverage. Sometimes people will use their VA plan, but they'll still get maybe the least expensive drug plan in case they need to run to CVS to get an antibiotic in the middle of the year. You know, they don't want to drive to wherever one has to go to get their VA coverage, but VA coverage would be considered creditable coverage. So open enrollment options. If you're in a Medicare Advantage plan and it's open enrollment, this is when you can change your Medicare Advantage plan. Maybe you're in a TEPS plan, you want to move to a Blue Cross plan, or vice versa. Maybe you're in original Medicare and now you say, you know, I think an HMO type of plan will work for me. This is the time of the year to make that choice and decision. It would be effective in January. So open enrollment is the time to do that. You can change your drug plan. Maybe the drug plan you chose, well, it could happen that you may be losing your drug plan. Every year things do change. If you have a plan now, and if anything's changing in it, you have to have information in your hand. You have to mail it by September 30th. So keep your eye out for information from your drug plan. You're going to start getting a lot of information in the mail, but if it's your plan on the envelope, that's an envelope you want to open up, okay? So they would notify you if the plan is being canceled, any major changes in the plan, premium is going up. One of the Blue Cross supplement plans, the premium actually went down by $2.
Yeah.
I get phone calls on that. People are suspicious right now. It's like, the plan went down, what's wrong? I don't know. The plan went down. That's good news, okay? So any kind of change, they are required by law to notify you by September 30th. So Part B, as a result of the Affordable Care Act, starting last year, came out with some preventive benefits. Things that you used to have to pay maybe a deductible for or copay for, now it is covered because of the Affordable Care Act. So things are starting to roll out because of the Affordable Care Act. Preventive benefits under Part B is one of those things. And there's a handout over there. It's this beautiful handout that Medicare has given us, and I really like this handout. I don't say that often about everything we get from them, but I like this one. It's very, has a lot of good explanation in it. And it will tell you, you know, some tests you can only have maybe every 24 months. But that's not unusual. Your insurance has always made those rules and regulations for you. You know, maybe you can have a colonoscopy every 5 years, but if you have a history of colon cancer in your family, maybe you need it every 2 or 3 years and your doctor says you need that. So that's why you would then be able to get it. But, you know, there's the rules and then there's exceptions to the rules. But this really does lay it out pretty well, I think. So those are over there if you'd like that. And this is one of the best I've seen of Medicare about the preventive benefits. There's a lot of good news with that. Some other things that the Affordable Care Act added as a result in Part B is what's called the annual wellness visit. This was announced last year. It's still in effect. It is not a physical. Believe it or not, Medicare still does not pay for an annual physical. When you first join Medicare, you are entitled to a physical. It's called a Welcome to Medicare physical. It has to happen within the first 12 months of when you are enrolled in Medicare. And after that, there really isn't an annual physical. But the annual wellness visit is time for you and your physician, your primary care physician, to have a conversation. Certainly they do height and weight measurements and do some other general review of things, review your family history, medical history, your own medical history. And that's when the doctor can say, all right, you've got a lot of heart disease in your family, so we want to make sure over the next few years that maybe you need a cardiogram every year. Maybe you need some other kind of testing over the next year or two. We're going to start thinking of that and schedule that. So that's when the doctor starts laying out your health care plan. And that's the purpose, and to review it every year. So that's the main purpose of the annual wellness visit. Any questions on that? I wish Medicare had changed their rule about the annual physical. That, you know, for years everybody has said to me, but I know I get a physical. Well, I don't know what's happening in the billing office at your doctor's office. You know, you go in for one thing and then the doctor says, okay, let's make sure we take your blood pressure, let's make sure we, do whatever, and things get done and are billed that way, but they can't check off that billing code that says complete physical under Medicare. It won't pay for it, okay? I must say, it's not real logical, but it is what it is, okay? The Medicare supplement plans for 2013, right now that list that you have, that blue list with all the insurance companies there, is all we know at this moment for the supplement plans. There were 6 plans up till maybe about a month or so ago. We know that there will be a 7th plan that's going to start in January. It's called, you see, it's HNE. I think it's Health New England. I have no idea what it is. I don't know what the premiums will be. We hope we will have that information sometime before open enrollment, but it could be the day before open enrollment. When we do have an updated list, Jeff will always have the updated list, so he will have that information here. So right now, as far as we know, that list that you have in front of you is pretty much it. Might change a little bit in terms of some premiums. We know there'll be a 7th plan. And also, recently, Humana added a rider to their plan. And you can see that there's a couple of different rates in that box. They added a rider in their plan that covers some dental coverage and some vision coverage. We don't, again, have a lot of information on it right now, but it will be out shortly when everybody starts, rolling out their information for their plans. But you can buy that rider only with their plan. You can't buy that rider and tack it on to another insurance company's plan. And it may be something that you'd want to do. You certainly don't have to. You can buy their plan with or without the rider. Okay. So Medicare, yes?
That's no bargain, right? I mean, you can get a dental plan anywhere for $150 a month, can't you?
No, that's the whole plan with the rider.
Oh, it is?
Yeah, so it's another 20, what I can get right.
Oh.
Yeah, okay, so without the rider, it's 137,
Yeah.
okay? With the rider, so it's the full plan plus the dental, plus the
that is
dental.
okay.
Yeah, that's good. Depends on what the coverage is. I don't know what the
Yeah.
coverage is, okay? Dental insurance, it can be pretty expensive and has very limited
Most
coverage.
of the Medicaid is line of what they don't cover.
They do, and I have dental coverage because I get it through work. I'm not sure I'd buy it on my own because everything I'm paying for at the dentist now costs so much anyway that the insurance company doesn't pay that much for it. You have to look at, what makes sense for you, and it might make sense for you. And if there's a good network with this, and your dentist is in the network, I don't have enough information. I need to give out half information, but that's all we have right now. But this could be a trend, because people are always asking us, what about dental coverage? Because you've always had it at work, and suddenly you don't anymore. So who knows, maybe more of these will be coming out, maybe a little more competition. It might work out pretty well. So we'll see what happens, but it certainly is a trend. I think that's a good trend. So the Medicare Advantage plans for 2013, we don't have information on those right now. It will be released just before open enrollment, and again, Jeff will have that information. As far as we know, the 3 companies that are currently here in your area, and they break it down by county. So in my region, I've got Suffolk County, Essex County, and Middlesex County. So they don't cover all the plans in all the counties, and the premiums can be different from county to county. So you will have the Middlesex County chart here. Jeff will have that as soon as we can get that information put together, as soon as we get it and we put it together. So I'm sure there'll be some changes with those. I've seen some preliminary numbers. Some of the premiums are changing. It appears that they're going up, but maybe the co-pays are going down. We don't know yet, but that's something you'll want to take a look at. When you're looking at whether or not to go to a Medicare Advantage plan or the supplement plan, again, you need to do a little math and say, all right, I go to a doctor, I go to 2 specialists every 3 months. And you start adding that up, and these co-pays with the premium, particularly if the premium is going up, might start costing you more than if you had the supplement plan that has a little higher premium, but you're not paying co-pays every time you go. So you'll want to take a look at that, and Shine Council can help you with that. Yes?
Just a quick question, Irene, for someone who was initially beginning Medicare this year, or early next year for that matter. Is the discounts for the supplement plan still in effect, the 15,
Yes,
10, and 5?
good point. Thank you for mentioning that.
Okay.
In the supplement plans, most of them, not all of them, but most of them, Blue Cross I know does, and I'm not sure if they all do, but if you're new to Medicare, make sure you ask about the discount plan. It will be 15% off the premium the first year, 10% off the second year, and 5% off the new year. That's if the third year. That's if you're new to Medicare. The Medicare Advantage plans don't do that. It's just the supplement plans to do that. But that's certainly, and then that kind of levels the playing field for a while too, again, depending on your situation. But that's a good discount, particularly in the first year. Okay. So the next, on page, I think it's page 8 for you, and it says Medicare Supplement versus Medicare Advantage plans. You know, there are pluses and minuses to everything, and it really, this takes up some information that you'll want to know about. That, you know, with the supplement plan, the premium could be higher, but there's no co-pays, there's no deductible if you have the full supplement one plan. There is a deductible if you have the core plan, but there's never co-pays when you go to a doctor's office. If you have a Medicare Advantage plan, the premiums generally are lower, but you will have co-pays every time you go to a doctor's office, every time you go for outpatient. And just a short story about that. We every year run into some people who you know, have hip replacement or knee replacement, and they have a Medicare Advantage plan. The hospital part of that is fine. Inpatient therapy, rehab therapy, inpatient rehab therapy, no problem. Then you go home. Then you start going for outpatient therapy. You go into the, you know, for PT 2 or 3 times a week, and you have a Medicare Advantage plan. It's $20, $30, $40 every time copay, every time you go for that outpatient therapy. That can get to be pretty dear, and a lot of people end up not completing their therapy because it's just too expensive. They can't afford to do it. You could clearly, if let's say you know, next June, you're going to have knee replacement surgery or hip replacement surgery. It's a planned event. You may want to think about a supplement plan because there's no question in my mind you will save money, you know, by doing that. But we don't, you know, we don't know if we're going to get hit by a car or lightning's going to strike, all those awful things that could happen in the world. But for certainly a planned surgery, if you know you're going to have a lot of therapy, outpatient therapy, the Medicare Advantage plan would be more expensive than the supplement plan ever could be, and they all work that way. So keep that in mind. With the supplement plan, you have the freedom to choose your doctors. And what that means is any physician, any healthcare provider who takes Medicare will take your supplement plan. In Massachusetts, that's 99.9% of the healthcare providers. There are a few doctor practices, physician practices down the Cape, and I think a couple up on the North Shore that are these concierge practices. They don't take any insurance. But that's a whole other level of thing. That's very rare. We don't bump into that too often. But if somebody takes Medicare, and that's almost probably everybody in this room, whoever you go to, they take Medicare, they'll take a supplement plan. So you can go from Mass General to Leahy or whoever, your local doctor down the street. You don't have to worry about getting a referral. You don't have to worry about, I'm going to be in and out of network. If they take Medicare, you're covered. When you have the Medicare Advantage plan, you are restricted to the network. Keeping in mind that that's great if everything works for you. If you go to someplace nice and warm for 3 or 4 months in the winter, and if you have to go to the hospital, and you have an HMO, you are out of network except for emergency care. So they'll cover you for emergency care. So you go to the emergency room, you'll pay maybe $50 or $65, depending on the plan. They'll take care of you for that. But if you need follow-up care at a doctor's office or outpatient while you're still in Florida, you're going to be paying for that out of your own pocket because you are out of network. I wouldn't make that decision based on a 2-week vacation, but if I was the kind of person that goes away for an extended period of time at any time during the year, you know, several months, Medicare Advantage may not work for you. And people find that out because they're in that situation, okay? And that's unfortunate. If you have a supplement plan, you don't need referrals. If you're in an HMO, you do need referrals. Most of us are used to that now anyway. Most of our work plans have been HMO, so we're kind of used to getting a referral from your primary care to go to a specialist, but so that's not as big a deal. With the supplement plans, it says here that some routine services aren't covered, vision and hearing, although now we see this something that's starting to come out, and certainly with the Affordable Care Act, some preventive benefits are being covered. So that's starting to be taken care of. Most of the HMO plans do have some vision coverage, some hearing coverage. They're not going to pay $3,000 for digital hearing aids. It's probably in the range of $150, and I don't know what you can get for that, but it's not a huge amount, but it's something. It's better than nothing, but it's not much. If you have a supplement plan, again, you can use it anywhere in the United States that takes Medicare, and if you have the HMO, the Medicare Advantage plans, you're restricted to the network. And people will say, well, gee, you sound like you don't like the Medicare Advantage plans. They're fine. I just, I just want people to be aware of the pluses and minuses of them. And just so that you know, in the United States, 75% of Medicare beneficiaries take a supplement plan. 25% take the Medicare Advantage plans. And it's not because it's not good coverage and that they do get good care, but if they don't like the restrictions of a network, or go to the doctors frequently and it starts to be too expensive, that's when it might not make sense for you. Okay? So there's a lot of thought that has to go into that. Any questions? Please feel free to ask questions. The drug plan. So the Medicare prescription drug coverage, as I said, it's actually fairly new. It started in 2006. Prior to that, there was no drug coverage. It's probably the most complex part of Medicare. It is called Part D. D is in drugs. And you can take it, if it's original Medicare that you go to, you'd be buying a standalone drug plan from a private insurance company. If you have the Medicare Advantage plans, it would be bundled in with your Medicare Advantage plan. You can buy a Medicare Advantage plan with or without drug coverage. It is your choice. Part D, technically, is a voluntary program. But if you don't take it when you're eligible for it, you will pay a penalty when you sign up for it. So very often what will happen is, I don't take any drugs, I don't need anything. 3 years down the road, now you've got 4 or 5 drugs. You sign up for a drug plan. You can do that during open enrollment, and there's exception enrollment periods, which we won't go into today, but that's something that the Shine Counselor, Jeff, can help you with that. But there's very specific reasons for that. But you sign up for it 3 years later, that penalty will be 1% per month of the average premium, which is around $32. For every month you should have been in a Part D plan and you weren't in it, and that is a lifetime penalty and will be tacked onto the premium that you pay for the plan that you enroll in. So when people say to me, I don't take any drugs, I really don't want to take a plan, I suggest to them to take a look at the list so we can find the cheapest premium. Like for this year, this calendar year that we're in, the lowest premium is $15.10 a month. If you never use it, that's fine, but at least you won't get the penalty somewhere down the road. But it's a decision that you're welcome to make. I just want to make sure you make an informed decision. But that's how, so if you don't have creditable coverage, if you have VA coverage, that's creditable coverage, you won't have a penalty. If you're actively employed and you happen to be on Medicare, you don't have, and you've got group coverage through you or through your spouse, then you don't have to take, and that's creditable coverage, you don't have to take a Part D plan. In fact, you don't have to sign up for Part B under those circumstances. So that's actively working, spouse actively working, covered by group health insurance through active employment. You're covered. You would just sign up for A because it's not going to cost you anything. You're not going to worry about B. You're not going to worry about D. So it's you or your spouse's active employment, unless it's a same-sex marriage. In Massachusetts, we recognize same-sex marriages, but the federal government doesn't. So if it's a same-sex marriage, those privileges are not there. Those two people would have to go get their insurance, make sure that they had coverage on that. Okay. So Part D, it's voluntary, but there is a penalty. Credible coverage takes care of it. It provides, this is for your outpatient prescription drugs. If you're in the hospital, Part B is going to cover the medications that you receive when you're an inpatient in a hospital. But if you're out of the hospital, you never go in a hospital, you've got blood pressure medicine, you've got cholesterol medicine, you've got arthritis medicine, things you have a prescription for, you would use your Part D drug plan for this. How do you pick a plan? You know, again, when it's a standalone plan under original Medicare, right now there are 34 plans. The premiums are all over the place. They range somewhere between $15.10 and $104. Some of them have zero deductible. The highest deductible it can have is $320 this year, $325 deductible for next year. We do have that number. There's different tiers, as all the drug plans have. There's tier 1, 2, 3, 4, there's 5, you know, there's all kinds of things. There's all these wonderful variations on it. You could get your drug plan through your Medicare Advantage plan, but it works the same way. There's co-pays or co-insurance when you go to the pharmacy. The premium is all bundled in there together. You could have a deductible, but it's all in there. They all work that way. Okay? So that is how you would get your drug plan. But we can help you with that. Within a drug plan, there is a premium, there may be a deductible, there's co-pays and co-insurance, formularies, we just talked about that. But how did you choose these plans from what I had just described to you? That's really when your Shine counselor and your computer, or both, become your best friends. Because what we do, and there are, I guess I have 2 blue forms, but the pre-enrollment form is another blue form, and it's over there, and there's envelopes. It's right next to that basket there. On the front of it, we ask you your name and your address, your Medicare number, your effective date of Medicare, your date of birth, and if you have any other insurance. And on the back, you'll see a bunch of lines, and we ask you for your list of prescriptions. Because you really choose your plan by the medications that you take. Okay? And we ask you for the name of your pharmacy. You can put up to 2 pharmacies in that plan, because there's preferred pharmacies with some of the drug companies. So the pricing could depend on which pharmacy you go to. Maybe CVS is beneficial with one company, maybe Rite Aid is beneficial with another company. So we ask you all that information. It's not that we're being nosy. We might be nosy, but not necessarily that. We just try to help you with that. You can actually do this yourself on the Medicare website. It's medicare.gov. But again, Shine Counsel will help you do that. We don't charge you for that. And what I would encourage you to do, even if you think your plan is working very well for you right now, it doesn't cost you anything to have a review of your current plan. Or if you're new to Medicare, this could, you know, and you need help choosing a plan, fill out one of those blue forms. There's a self-addressed postage paid envelope. You can mail it back to us. We will send you a report, and then if you need some help with that report, you can make an appointment with Jeff, and he can go through that report with you. Jeff can do that as well. We're bringing these to presentations because sometimes it could be 10 and 12 reports come in at one time, and unless Jeff never wants to leave here, we're going to help him out a little bit back at the regional office. We're doing that for all of our sites, okay? But it doesn't cost you anything to take a look at it, and it doesn't cost us anything at all. We're happy to help you with that. And we'll give you the choice of 3 plans, not 34 plans. And how is that sorted out? According to the medications that you take, the system, the default sort is wonderful. It's the lowest estimated annual cost for that plan, for you, for that year. And it takes into consideration your monthly premium, a deductible if there is one, and the co-pays of the drugs that you take. When you go to pay for those co-pays when you go to pick up your prescription at the pharmacy. And we'll ask you, do you fill this drug every month? Maybe you only fill it every 3 months. That would change the price versus every month. So it's an apples to apples to apples comparison of 3 drug plans. So you can look at it and say, okay, even though the premium on this plan is higher than this plan, when I look at the end of the year, the one with a lower premium may actually cost you more at the end of the year because of the way they sort their tiers of drugs. You know, Lipitor can be a tier 1 in one plan and a tier 3 in another plan. I mean, any of the drugs can be like that. It is a very challenging way to choose drugs. You didn't have to do this when you were working. Your employer said, this is your insurance, this is your drug plan. It gave you a list of the tiers of the drugs in a booklet. But you didn't have to make any decision. This is very personalized. There's no group coverage or family coverage with Medicare. A husband and wife could have two totally different plans based on, if it's particular Medicare Advantage plans. Maybe they go to two different doctors. One doctor's in one person's plan, not the others. So you might have two different plans. Certainly, unless you take the exact same drugs and the same dosage and fill those things exactly the same, one plan isn't going to fit all. So it's completely separate. Nothing is family coverage anymore. You're really on your own with that. Any questions on the drug plan? Okay. In the drug coverage, there's a thing called the donut hole. Has anybody heard of the donut hole? The donut hole was invented in 2006. We thought it was way before that. But when it comes to drug plans, the donut hole was invented in 2006. And when $2,930, and I think it's $2,970 for next year, has been spent on your medications, that doesn't mean you spend the $2,900 and whatever dollars. It's what the plan has paid towards those drugs and those co-pays that you're paying. When those two things add up to that $2,930, you fall into the donut hole. What that used to mean is that you were paying the full price of the drugs. A couple of years ago, in 2010, because of the Affordable Care Act, things started to change with the donut hole. The donut hole is shrinking and will go away. It will go away in the year 2020. I probably won't be doing this presentation then. Maybe not, I don't know, we'll see. But, but what it's starting to do is it is shrinking. So in 2010, if you were in the donut hole, you got a rebate of, I think it was $250 if you fell into the donut hole that year. It should have automatically happened through your insurance plan. You got the check from Medicare, but your plan and Medicare were communicating about that. And then what started to happen last year is if you went into the donut hole, you get discounts on your medications. 50% for brand names, and then you get a 14% discount if it was a generic. So the discounts are continuing to happen, and they're kind of leveling off slowly, and eventually the donut hole will go away.
Is it a good thing or a bad thing?
It's a bad thing. It costs you more money. No, it's a good thing that it's going away. It's a bad thing that it was in the plan designed to begin with.
When you fall into it, it's a bad thing?
Yeah, because you pay more money.
Oh, 'cause you're standing up there and making it sound good, so.
Well, no, the good news is that it's going away. Okay, and that's the good news that I'm delivering about it. Because it's a bad design. I don't think it's a good design.
So when you fall into it,
You pay more for your drugs.
you pay more for your drugs,
Right.
simple as
But
that.
because of the Affordable Care Act, you're now not paying as much as you would have if you fell into the donut hole 2 years ago. Okay, you were paying 100%. Now you're paying less. Another program that we have in Massachusetts, however, if you qualify for it, is called Prescription Advantage. Some of you may belong to that. Prescription Advantage is not a drug plan. It's a wraparound to your drug plan. And it helps you for additional protection when you're in the donut hole. It will give you bigger discounts, so you'll pay even less than what I just described if you qualify for Prescription Advantage. Prescription Advantage is only goes by income, doesn't go by assets. Again, I would have, there's an application to fill out. That's something Jeff could help you with. There's 5 levels of coverage, and it's a single income versus family income, and but it's something to take a look at. And if you're under a certain income, it doesn't cost you anything at all to sign up for Prescription Advantage, so it's a good thing to sign up for. We encourage people who say, I really don't want that drug plan, to at least sign up for Prescription Advantage. So if they change their mind 6 months later and it's not time for it's not open enrollment, you get an exception to the enrollment period once a year with Prescription Advantage. So it's good for a couple of things. Helps you in the donut hole, and not everybody goes into the donut hole. Typically, somebody who's got a few very expensive brand name drugs will fall into the donut hole in maybe July or August of the year. Although I just did a plan finder for somebody yesterday. She was in the donut hole in January because of the expensive medications she was taking. She's filling out her prescription advantage application form as we speak. So it will help you when you're in the donut hole. It will give you an exception enrollment period during the year to change your plan, whether you're on original Medicare and you want to just change the drug plan, which is all it's for, or if you take your drug plan through your Medicare Advantage plan, you can actually switch Medicare Advantage plans because of prescription advantage. Again, it's an exception to the rule. Medicare Part D plan for a long time did not cover benzodiazepines, so Valium, drugs like that, and some barbiturates didn't cover it. In 2013, that's going to change. So that was something that Prescription Advantage helped you with, but the drug plans will be changing that in January. They voluntarily can change that, and I'm assuming most of them will make that change. So that's very helpful. So Prescription Advantage is something to look at. Medications, as you know, can be very expensive. Another thing is Shine Council. Shine Council can do a lot of things for you. There's a federal program called LIS, or Extra Help. And Extra Help is a federal program according to income and assets. And there's full extra help and partial extra help. And if you qualify for extra help, you could get a lot of assistance, again, depending on your income level and asset level, with your prescription plans, including paying for 100% of your premium. If you had a penalty from never signing up for a plan, it would be erased. You'd only pay a few dollars for your medications. So when you meet with a Shine counselor, again, we're not being nosy, we do ask you gross income, general numbers. We're just pre-screening you, and we're asking your asset information as well. We want to see if you qualify for some programs. So that's something to think about. Or maybe you know somebody that's really struggling paying for their medications, and we might be able to help with that. And I'm glad to do that. That's one of our main missions, is to help people who need help paying for those things. A lot of middle-class people qualify for partial help, and it's not like full mass help where your income has to be very low, and we do screen people for all the plans. But partial extra help is something a lot of people are qualified for, and they don't realize it. So it's something to clearly look into. The Part D coverage for this year versus next year, really, there's just a couple of changes right now. We know the highest deductible can be in 2013 is $325, but there are plans with zero deductibles in it. But sometimes that plan with a deductible at the end of the year may end up costing you less money depending on what drug you take. There's not one simple answer to that. The donut hole coverage limit has gone up by $40. So there's just a few minor changes on that, nothing major in terms of the design of the plan. The actual plans, however, premiums will change, tiers will change. If you're currently in a plan and anything's changing, you will be receiving some information in the mail. And again, by law, you have to be notified by September 30th. We talked about some of the assistance programs, so there's Prescription Advantage, there's Extra Help, there's many mass health programs. Again, most of them are income and asset requirements, but there are some programs that just require some income levels and some higher income levels that you can get some partial assistance with. So it's something to talk to the Shine counselor about. A lot of people will say, I just don't want to fill out all those forms, and I don't, want to tell everybody my financial business, and I can understand that. But unfortunately, the only way you can get any assistance that you need, or a friend or neighbor, family member, if you know somebody in that situation, and they really could probably use some help, encourage them to fill out the forms. We can help them with that, help you with that. Somebody say, oh, Mary down the street gets everything. Well, Mary filled out the forms. I don't care about any politics that go behind. Somebody filled out the forms. It doesn't matter how she did it or how it happened. Somebody filled out the forms. So unfortunately, you have to do that if that's in order to be qualified for anything. We can't qualify you for that. We can just pre-screen you. We might say, oh yeah, no, your income is way out of line. Or maybe it's borderline, it might be worth applying and let them go through the evaluation. It doesn't cost you anything to apply for any of the programs. We're glad to do that. Resources, we give you a list of some resources here. There's the Medicare, the 800 number for Medicare. You can call Medicare during open enrollment, and they will take your drug information over the phone and can make some recommendations over the phone and help you choose your plan if you don't want to sit down with the Shine counselor. And Medicare, particularly during open enrollment, but I think it's always true, they're open 7 days a week, 24 hours a day. So there's a nice 800 number you can call there, and they do put extra people on during open enrollment. Also, the Mass College of Pharmacy, they have a wonderful outreach program. It used to be called Mass Medline. It's now called the Pharmacy Outreach Program. There's an 800 number there for them. That's a number you call. They would help you over the phone choose a Medicare Advantage plan. They also have a wonderful service that I let people know about, but I ask you don't bother them during open enrollment. After open enrollment, when they've got more time on their hands. If you take a lot of medications, you get them from a lot of different doctors, and you're kind of managing it yourself, and maybe you go to a couple of pharmacies, you don't have one pharmacist, I always recommend that you try to go to one pharmacy. Maybe you do mail order for most things and then a local pharmacy, but your pharmacist can be your best friend. That's who's going to say to you, you might want to check with your doctor before you start this medication because I know you're taking something else, maybe it conflicts with it. Doctors depend on pharmacists for the same information. There's just so much out there. It's a specialty unto itself. So, but you can call the Mass College of Pharmacy, this phone number here, the outreach program. They will do an evaluation of your medications over the phone. They'll take that out and they might say to you, there's a new generic out on this one, or maybe you want to see if these two conflict to go back to your doctor. They're always going to point you back to your physician, but they don't charge for this service and they're happy to do that. So if it's something on a snowy winter day and you're sitting there with all these pills and you're thinking, do I really need to take all these pills? Sometimes you can find out that you don't have to take all those pills, but it's worth it. Prescription Advantage we talked about. The Medicare Advocacy Project. The Medicare Advocacy Project is a wonderful service that we have here in Massachusetts. It's out of the Greater Boston Legal Services. It's a free service, wonderful lawyers. And if you've got a really challenging situation with Medicare, maybe, well, I'm going to give you a really good example, and this is a real example. It has been happening across the country, and we're hoping it's going to get resolved. If you're on original Medicare, and you have to go to a skilled nursing facility for a period of time, in order for Medicare to pay, let's say, 14 days, worth of that, you're going to be in for a couple of weeks, you have to have been admitted to a hospital for 72 hours. A lot of people end up finding out that they were in what is called observation status. You're kind of hanging around the emergency room for a couple of days, you haven't been admitted, observation status. It's really obvious to you if you're in the emergency room all that time that you haven't been, or you think it is. Sometimes you could be admitted, technically. There's no bed available yet, so you kind of get stuck in a corner in an emergency room. But actually, you can actually be put in a room sometimes and still be on observation status because you have not been admitted. If you have not been admitted to a hospital for 72 hours and you go to a skilled nursing facility, guess who's paying that bill? You. And it's a battle all the time. People don't know they're on observation status. They don't know. Why would you think that you're too sick to even ask the question? But I let people know about this so that they can make their family and friends aware. If I go to the hospital and if I'm not, quite with it through this process, find out if I've been admitted. Am I going to be admitted? Am I being admitted? Are they transferring me someplace and they didn't admit me? Cases like that, the Medicare Advocacy Group loves it. They want to fight for you and they won't try. They're trying to get this requirement eliminated from Medicare because it's just such a vague situation. People don't know. I've had people say to me, I was in the hospital for a week, I was in a room, they changed my bed, they brought me food, but they were never admitted. Some of the reason that they're never admitted is a hospital, some hospitals, I'm not saying every hospital, some hospitals are afraid that the diagnosis isn't strong enough that they're going to get reimbursed by Medicare. This has been going on for years. okay? It's become more prevalent over the past couple of years, but this is not new. And however, the problems with it have become more and more prevalent because, you know, all the insurances are being very careful about how they're spending their money and whatever, and it's becoming an issue. I mean, I say I should have this tattooed, you know, have I been admitted? And please color my hair. I'm always going to tell them. It's the only two things I want tattooed. If I have to go to a nursing home, never come up. But I mean, it's really, I don't mean to make a joke of it, but it's really important that people ask that question and just don't assume because you're in a room that you've been admitted.
How do you know?
Ask. Have I been admitted?
How do you know they're telling you the correct answer?
Well, they can show you paperwork.
Have to sign
They
it.
can show you, there are certainly, you actually have to sign something to be admitted, or a family member has to sign something to be admitted. There are forms and paperwork that goes along with that. And clearly, I would ask that question, or make sure my family member that's hopefully a friend that comes to visit me can check that out for me.
But we asked, I mean,
You
you
ask
present this as a serious problem, but how do you know?
So you're in an emergency room, a nurse comes into your cubicle.
But you may be just out of it.
Right, but that's what I'm saying. That's the problem.
I guess I'm asking, what's the proof? You can tell me anything you want to tell me, but it doesn't
Well, I guess
necessarily.
then you're not going to believe me, because I'm going to tell you that I went and looked it up. I'm going to show you a paper that said
Okay.
Charlie Jones has
Okay,
been
that's what
admitted.
I'm asking for.
Right, there's
Let
a
me see the
form.
paper.
They can't admit you without some paperwork, so you'd want to see that, and you'd want your family member to see that. But it's something that you should make sure, you know, people who are around you know that. I wouldn't just take somebody's word for it. I'd say,
That's what I'm asking.
show me the form. You know, I'd like to know if I've been admitted. What time is it? Because when they admit you, it's date stamped. You know, it's 2:42 a.m. Tuesday morning or something. So you'd want to know that.
But I've never known how you would prove that all these years.
There's paperwork with everything in a hospital. So
Oh, I know.
there would be an admission form, admission date, time.
You're talking about something that seems so automatic all our life, and now all of a sudden.
But now that it's an issue, and who would be aware of it until you got a bill? You wouldn't know. You're thinking, well, they're doing, and it could be that you really, you know, can't be admitted. Maybe the diagnosis, I mean, there are times when somebody is just, can't go home, but can't be admitted to a hospital.
No wonder they left it. This is criminal. What they're doing.
They left, and at least if you're informed, you know, you can hopefully do something about it, or call your doctor and say, you gotta admit me, because they're gonna then put me in, you know, hopefully it's gonna be eliminated. They're trying, every time there's a case of this that we know of, we report it to the Medicare Advocacy Group, because across the country, similar groups are bringing it to Congress as we speak. So we think it's actually going to disappear, but believe me, you will hear about it, because we'll definitely make sure we notify our Shine councils about that. That is an extreme situation. It could be something, a stupid billing question. You know how, you know, with any bill that you get, things can get messed up. You've tried every resource. You have called them and said, I paid that bill, oh, they're still billing you. Might be something you just cannot resolve. Shine counselors will help you with that as well, by the way. Our Shine counselors very rarely can't resolve a problem. But every now and then, we can't resolve a problem. And we might say to you, call the Medicare Advocacy Group. So the phone number's here. But also on these yellow cards are some of the same phone numbers that we were talking about, including the Medicare Advocacy Project. It's a wonderful resource here in Massachusetts. They love the challenging cases, no question about that. And you know, feel free to share the information with anybody that you know, okay?
Does this have to be this involved and confusing, or is this just so somebody can make a lot of money?
Well, which part? I mean,
The whole thing, I mean, it's my head spinning, and I mean, I've had my own business for years, and
right.
this is probably the 10th meeting I've been to.
Yep.
And you pick up a little here and there, but
Well, I mean, that's why the SHINE program was developed back in 1985 to help people through the process.
is it necessary to be this involved for
I
this?
think you should contact your congressman and ask him.
Yeah,
I mean,
good luck.
well, it is the way, and you know, Medicare has grown. I mean, it was, the Medicare Advantage plans weren't around up until about 15 or 20 years, whatever year it happened,
Uh-huh.
okay? So it was just original Medicare and no drug plan. So it was simpler, but you didn't have as many choices, you didn't have drug coverage. Once they added drug coverage and the Medicare Advantage plans, people had more choices, so it grew. And so that's what happened. It would be nice if it was simpler. I have to tell you, I was in human resources for 20 years. I talked to insurance companies. I'm the daughter of a man that worked for Metropolitan Insurance for many years. He still doesn't want to, he's 91, he doesn't want to talk to health insurance. He still hates it, okay? And he said he's glad he retired before they really got popular, you know? But Medicare is the most challenging of the insurances, because truly, your whole working life, pretty much your employer says, okay, we have one plan, yes or no, maybe two plans to choose from. You know, if you work for the state or the government, you may have a couple of plans, but you don't have to go through all of this with listing your medications and whatever. You still want to check to see if your doctors are in network, if it's an HMO type of plan. That you've always had if you've had an HMO. I can't disagree with you. I wish it was simpler.
They ought to give a course in high school, how you're gonna get screwed 40 years later.
I think they should have a course in high school on how to write a check.
Yeah, how to balance your checkbook.
How to balance your checkbook, how to go grocery shopping, how to not spend more money on your credit card than you can possibly pay, and start thinking about insurance.
How about parents teaching those things to
Well,
their
that's,
kids?
well,
Like,
yeah, but after a while, they don't get that. No one's teaching us. We're down into several generations who don't know that. But anyway, you are right. It would be nice if this was simpler. It's not.
No, it's the way it is.
It's the way it is, and I can't even apologize for it because I can't do anything about it except to say we can help you, okay?
Oh,
So
yeah.
you've got some wonderful service here with Jeff. You've got, there's a sheet there that talks about the SHINE program. On the back are all the counseling sites where we are. So if you don't live in North Reading, or you have friends and family that are in Stoneham, Melrose, Middleton, whatever, we are at all the senior centers there. Certainly the regional office back in Malden, people can come there. Because obviously it's a volunteer staff, they're not here every day. At the regional office, I do have some staff. I only have, including me, 2.5 paid staff. Everybody else is a volunteer counselor. So, but you know, we're happy to help out. Can I answer any questions? Did I answer your questions? Did I confuse you even more?
No, you answered a lot of questions, because I'm new.
Okay. And you know, clearly, sitting down with somebody to go through your choices is really very helpful. I have people, you know, I have a friend who's truly a rocket scientist, went to MIT. I don't need any help, I think, a couple years ago. Okay. Well, 3 weeks later, I think I need help. Well, you live in Newton. I think you ought to call a SHINE counselor in Newton. But really, that's what he actually ended up doing. And he said, I have never seen, and he ran his own business, and he said, I have never seen so much confusion. I hate to keep using that word because it's just, it is over. But it's the drug plan part that's the most confusing.
Yeah.
You know, it really is. And so you
We're
can
very
get help.
fortunate. We can go up there telling us all about this. We're probably a 0.5% of the people in this town that should know the same thing we're.
Right.
And they could have been here, but I mean, a lot of them don't even.
Right, no, a lot of people don't.
Ignorance.
Or a lot of people say, you know, I picked my plan, the premium's gone up a little bit, I'm fine, they don't want to make changes. I mean, we do some promotion, you know, through the newsletters, the cable TVs. Your Medicare book, actually, the Medicare and You book that you get, they will tell you to call a SHIP office, which is really us. So there's a, you know, if you need help.
Most people are ashamed to admit they don't know.
Right. Well, I have to tell you, I think more and more people are starting to decide that I'm not the only one that does, particularly the baby boomers. I mean, when we have baby boomers come in, I'm a baby boomer, and it's like, those are the longest counseling sessions, because everybody's done some homework before they come in. Everybody's been on the computer, they come in with stacks of paper, more confused than ever before, and they're very happy to help, but everybody wants to understand because we are the generation that thought we knew everything, and we do. But there's a lot to know. And you can, the more you start looking up on the internet, the more information is being thrown at you. And then you have all these ads on TV.
Yeah, that's.
You know, I mean, you're noticing the ads on TV, and you're noticing them more now because of open enrollment. But all summer long, they're talking about baby boomers. You see that number, 10,000 a day, and they're trying to sell you bikes or anything else. But they're trying to sell us anything because we're such a huge, you know, we've been a huge market for a long time, and we're going to be a huge market for a long time to come, which is why everybody's kind of worried about Medicare, because we're all hitting it in huge numbers. But it's the most challenging group because there are more choices. If you joined Medicare back in 1985, you only had original Medicare and you really didn't, and you just stayed with it for the most part and didn't make any changes. Drug plan would be the only thing that you could probably come to talk to a Shine counselor about in a lot of situations. But now that there's more choices, you need a little help. We're here to help, and it's free.
What's this Medicare control in the last?
The Medicare control, that's for Medicare fraud and abuse. It's actually, a lot of money has gone into to that program, and it's the SMP program. And when you get the Medicare summary notice, you get that quarterly from Medicare, you know, at the bottom it says if you suspect any fraud or abuse, it's an 800 number that you can call. You can also report something to the SMP program. They have been very active across the country reporting if there's abuses or potential abuses of the system, particularly in some states that have a high percentage of seniors, Florida and Arizona. I mean, Florida and Arizona are off the scale in terms of billions of dollars of Medicare fraud. A lot of money has been poured into it. The Affordable Care Act has put a lot of money into that because they're trying to recover some money. It's a very systematic way to. But if you, I always look at that Medicare summary notice, and you know, question it. I mean, that's where it says it's not a bill, and then it's going to show you what has been billed to them this year, this quarter. And sometimes you'll say, gee, I don't recognize the name of that doctor. Well, if you've been in a hospital, sometimes there's doctors who have read your x-rays, who are sending a bill. And that's why you don't recognize the name of that doctor. I still, if you want to question it, you should call and say, who is that doctor? I don't know who it is. So you could call Medicare, call the hospital and say, who's Dr. Smith? I don't know him. If you knew you were never in the hospital that day, that could happen, or there was this big thing I think on 60 Minutes a few months ago. It was in Texas. It was a home care, like a VNA, it wasn't a VNA, but it was a couple of home care agencies that systematically were billing all kinds of people who didn't need home care service. They'd go up to you and say, don't you want home care? Okay, and they were caught. In fact, it was somebody's grandmother that was the undercover person for it. She wasn't even a professional. And they were telling her, they were billing for her all this home care service, VNA and personal care attendants. She didn't need any of it. She never got any of it. And thousands of dollars were being, they arrested like 5 doctors and 4 agencies that they were running. Now, hopefully, we don't have too many of those, but they exist. That's how they were caught. It was from that. So if you say, I was never in the hospital in June, and why am I being billed for June? Call the 800 number or report it to the SMP. But that's how those things get found out. Keep your eyes open. It's okay to ask the question. Somebody might answer it for you. Oh yeah, that's right. I remember. I did do that. I did have that X-ray that I completely forgot about. But so if you're not comfortable with it, ask. That's how things get caught. That's all I have, except to answer any questions. So remember, October 15th is open enrollment. It ends December 7th. Don't miss those dates if you want to change anything.
Thank you, Irene.
Thank you.